I'm delighted to be here. Judith Karshmer, Dean of the Edson College of Nursing and Health Innovation. And I have the good fortune of working with these amazing colleagues who are going to be talking from their expertise. And this is part of our initiative to really make ourselves connected to you. Our goal is that as a College of Nursing and Health Innovation, we have vital opportunities to partner with the community, with all of you, with the groups that you are representative of, so we can bring our expertise to you and find out what it is that we can contribute to what's going on in your world. But I also have the good fortune of being the ASU Chief Wellness Officer. And that's what I want to talk to you about today, about wellness and wellness practices. Now, when I became the Chief Wellness Officer, I had the good fortune of meeting with constituents all around the university. I'm not sure if you've ever noticed this, but ASU's big. Did you notice that? Big. And we have a lot of resources, amazing resources for our students, for our faculty and staff, for our on-ground students, for our online students, for our students in Tempe and our students in downtown. And the real problem is keeping track of all of those amazing things and how they coordinate with one another and what's going on. And what became very clear to me as I was looking at the wellness practice at ASU and how to really make wellness part of our day-by-day thinking is that, first of all, we have to think about what is wellness, what are wellness practices, and how do we then advance them. So I think that the definition for you to read is sort of your global definition. But what I want to talk to you about is the idea that everybody has wellness practices. Why wellness? Well, one of the big bits about wellness is that you stay healthy. Your physical health is directly related to your wellness practices. Your work in your industry. We know that a healthy workforce makes for better business outcomes. We know that if a hospital has staff that is they're healthy, then they're going to do a better job of taking care of the people that come to them. We also know that the whole idea of connecting with our family is more significant on health than exercise. We know that your belonging, your sense of belonging, the family connections, the friend connections you have, has a causal relationship to your health. So when we think about wellness, we're thinking much more than exercise, diet, any kind of practice, yoga. We're really thinking about what is the totality. And what I want to talk about today is this idea that wellness is more than being healthy. What we need to do is identify wellness as a value. In my opportunity to talk to people all across ASU, the question I would ask them is, what are your wellness practices? And they say, well, I guess I should go on a diet. Oh, I guess I should start mindfulness. Well, I've been thinking about, running. I've been thinking, I was going to do a marathon next week, but So people have all these great ideas, but they don't recognize that everybody has wellness practices today. So it might be that you use sunscreen. That's a wellness practice. You do it because you know that that's good for you to keep your skin from getting skin cancer. Or, I only drink light beer because I know that that's going to be better for me. Or, my exercise is one that I walk to my car. So we need to first start with identifying with people what is your wellness practice. Not what is my wellness practice, not what you should be doing, but what is your wellness practice. And by identifying that first, we start dealing with where you start, not where I want you to be. The last thing we need to do is add one more activity that you don't do. So we start with what is your wellness practice, how did you learn it, and is it doing what you want? Wellness really then helps you have a healthy purpose in life. It really is something that we target both our work and our play, that it's important for us to form meaningful relationships. And in fact, if you have a wellness practice with somebody, it's even better. It's even better to have a wellness practice with somebody. It helps you form relationships. It encourages you to have the connection between your physical and emotional health. And if you look at wellness as the environment, then it makes us care about the safety of our environment. And I mean safety in every sense. Safe because you feel safe, the environment is safe, you don't mind walking at night. Safe because the weather is not too onerous and you're not going to have a heat stroke. That we look that impacting our environment is just as important as impacting our own behavior. So wellness as a value is my appeal to you. And as you go to your family or to your work or to your organization and you talk about what are we doing to stave off burnout? What are we doing to make sure that wellness is part of our everyday thinking? It's not about adding a new program. It's helping your colleagues, your family members, your friends, your neighborhood look at what do we do already and is it working? So when you value wellness, we really are looking at the overall relationship between the personal experience and how each of us may be doing something different. We learned during the pandemic how easy it is to get closed in, how easy it is to not reach out, and how important that is, that we need to make sure that every day we have a measure of joy and a measure of looking at how today I'm doing something good for myself. So the 8 dimensions of wellness is what we like to look at in terms of thinking this through. It's everything from emotional, your spiritual, your social, physical, occupational, financial. We notice at ASU, for instance, that our students, one of the biggest negative impacts on their wellness and wellness practices is their financial stress. So to not think about wellness in all these 8 dimensions is missing a key part of how we need to look at what is a wellness practice. So a wellness practice might be a part-time job. Engaging in daily wellness practices alleviates life stressors, it strengthens our resiliency, and probably most importantly, enhances our quality of life. It can also decrease the incidence of death, not a good thing, or in terms of the opportunity to really live a healthy, more productive lifestyle. So my appeal to you is to try a wellness practice. Think about how in those 8 dimensions of health, what can you do to have a wellness practice? So an emotional one, pet a dog or a cat. That's a wellness practice. Talk to a professional. See a therapist. Or don't go home for the holidays. Or spiritual. Keep a journal. Some people find that, I don't particularly like to keep a journal, but some people find that useful. So the last thing I'm going to tell someone is to keep a journal, but maybe that's going to be helpful for you. Volunteer. See your favorite band play and sing loudly. I did that at ABBA on Friday night at the Phoenix Symphony. And nobody cared how badly I sang, by the way, because the people next to me, they were not so good either. Intellectual, do a puzzle. Leisure, read a book that has nothing to do with your job. Produce a how-to TikTok. I don't know if you found TikTok or Instagram during COVID, but I did, and I don't make them, but I do enjoy watching them. And if you've not seen the pair of eagles at Big Bend, anybody seen the eagle pair at Big Bend, California, sitting on 3 eggs, 24/7 coverage of them sitting, the female of the pair, 36 hours sat on those 3 eggs during a snowstorm, never left. You can watch it anytime you want on TikTok. Or let's see, Earl's not here. Or you could finish your dissertation. Physical, stretch while you're at your desk, wear sunscreen, challenge someone to a handstand competition. Take out the trash. Sit near a fountain, Clorox your desk, or mow your dad's lawn. Do something physical that is not, I'm going to go and do a 40-mile bike ride. Financial, track your spending. Listen to a financial podcast. Don't order from Amazon today. Occupational, attend a potluck. Take a break. Host a potluck. Put a plant on your desk, or ask for a raise. That would be everybody but this group. and social. Attend a sporting event, call home, join a club, spend time with your family, or go to bar trivia. Those are wellness practices that you can put into your life today. You can feel more healthy, more connected, more resilient by noticing how it is you do things, how you can make them intentional, and how they will build wellness practices that will, ones that you won't have to lie about, and ones that you will be able to daily engage in. So thank you.